back in the day, you would have estimates, but there weren't formal written things. It was, you call your provider and say, hey, what are these services going to cost? And they would give you an estimate. And now, once we have these complex, high deductible plans, co-insurance, co-pays, patients now need to understand exactly what this policy does and how do we get you to that point of explaining that estimate.
I think too is the contracts, right? So depending on your plan, the patient doesn't understand the plan that they're enrolled in. So if they don't have insight to that, that's where we come along to try to give them that insight to say, your deductible is this, and you're gonna have to pay out of pocket for this. And really, they don't know what the insurance picks up and what we charge and what's the reimbursable amount from the insurer. So I think the patients struggle with that. They think it's one price and that's what they pay. It's really bridged a lot of our gaps because we can go in and select. You put in the plan and the payer, right, that the patient has, and then the CPT codes that we know up front. You're going to have an appendectomy and the surgeon's going to be doing this. You're going to have this PA assisting with it. And we can kind of populate those fees in, so not just the hospital technical fee, but the professional fees, and it can provide a combined estimate, which that wasn't possible before because we had our professional office on a different platform and our hospital technical fees on the Experian platform. So now we're on one platform and it provides an estimate that you can text a patient or print out that they can read and digest.
Additionally, we use claim search in the estimate tool. So that takes the diagnosis and the CPT codes, which gives us a far more refined estimate. It gives us our add-on codes if it's orthopedic. It'll give us comorbidities if the patients have those things. So I think that's your point exactly, that it's so much better now because we have better tools.
To Michael's point, it's the detail, right? The devil's in the detail, and being able to drill down and having that claim history that Michael referenced of being able to put in a CPT, a DRG, having the comorbidities, understanding having our contracts built out with an Experian to say, hey, this payer and plan is this, where we never had that. We were literally doing averages prior to that as saying, okay, what did we get reimbursed from these payer and plans?
And I also think that the interface, it's user-friendly. You don't need to be a techie, you don't need to be a clinician. It's really just drop down menus and then it produces it.
Sure.
And also, when you create the estimate, there's also a breakdown that explains how we arrived at that number. So if a team member is speaking to a patient, whether in person or on the phone, they could go, okay, so this was the charge, this is your deductible, this is what remained, and this is how we got to it. And I think that's key for setting expectations. We're comparing what the estimated value was, what contract adjudication came through, and how did that land with the patient. And also, the goal to this is to reduce patient calls. So if we get it right, we don't get a call of, hey, how much was this?
Right,
so
good point.
Patient experience is one of our metrics with it, and as well as actual accuracy. What I like most about working with Experian is anyone could provide a tool, anyone could do a good install. It's the minute after we've gone live that our support doesn't disappear. There are partners. We don't know everything. This is new to everybody. So as we're evolving, we're finding nuances that no one knew about. So we come back with our team and speak with our Experian partners and say, hey, how do we address this? Is there a way we could do this so we could do it better?
Yeah, I think you hit on that, Michael. The partnership is what makes it great. The fact that there's collaboration, that they come to us looking for ideas, or what would you want us to do differently, or how can we enhance this? I think that's huge.